Hi, a very good morning, all of you. So, welcome to day 5 of our 21-day challenge 5 a.m. club. I hope you guys are all ready. So, how was your last night's sleep? As I said, even yesterday, a good sleep is very essential for a good day. So, make sure that you're having quality sleep. Just check out the instructions which are posted at the beginning of this 21-day challenge in our Telegram group as well as in YouTube channel, and make sure you're getting a quality sleep, a sound sleep, right? So a very good morning once again. So let's go ahead with today's discussion. I hope you guys are ready. So day 5 of our 21-day challenge. Let's have some gentle discussion. So the topic, the context here is courage. When I say courage, it's not about fearlessly standing on road in spite of heavy traffic. No, that's not the courage we're talking about. That would be foolishness. But let's see the context here. So, as you know, the reference is from Psycho-Cybernetics by Maxwell Maltz. Having a goal and understanding the situation are not enough. You must have the courage to act, for only by actions can goals, desires, beliefs be translated into realities. We all have goal, you all have goal to crack the entrance. You understand the situation, you are into the situation, and along with them, having courage to act is very important. And this 21-day challenge is the best example I can give you. You should have the courage to take an action or to decide on taking or going ahead with a plan of action. You all been waking up at 5 o'clock. You're determined to give your best. You're determined to make maximum use of this early morning time where there is magic in air. So we need courage to act. It's not easy otherwise. So, having a goal and understanding the situation are not enough. You must have the courage to act, for only by actions can goals, desires, and beliefs be translated into realities. Again, it cannot be more true. It's through action we actually accomplish all our goals and dreams. And continuation, just look into the highlighted areas. All problems, personal, national, or combat, become smaller if you don't dodge them but confront them. Touch a thistle timidly and it pricks you. Grasp it boldly and its spine crumbles. And also, if you remember, in one of the previous live sessions, we discussed about faith. Faith is not believing something in spite of evidence. Rather, faith is the courage to do something, regardless of consequences. Whether you crack entrance or not, whether you get first rank or not, no, that's not should be your guiding force. It's your ability to believe in yourself and to focus on the task at hand. So faith is not believing something in spite of evidence. It's a courage to do something regardless of consequences. And we all look for guarantees and warranties. Maybe it's true for gadgets, but when it comes to real life situations, things are entirely different. Who's going to give us a guarantee, a warranty? So nothing in this world is ever absolutely certain or guaranteed. Often, the difference between a successful person and a failure is not one's better abilities or ideas, but the courage that one has to bet on his ideas, to take a calculated risk, and to act. And this holds true not just for preparation, but for anything in life for that matter. So, having the courage to act will ultimately enable us to accomplish our goals or dreams. So, do you have that courage? Do we have that courage? Is the real question. We should keep asking ourselves, especially in such a challenging journey like competition or entrance preparation. So, you have a goal, and you have that willingness to work. So, are you actually working? So, that's something which I wanted to ask yourself. So, having a goal and understanding situation are not enough. You must have the courage to act. And for only by actions can goals, desires, and beliefs be translated into realities. You can just make a note of this and paste it anywhere you want. So this is the general part of the discussion which I wanted to highlight. I'll just quickly get back to you again. Please confirm the audio and video quality. Again, I know it's a bit too late to ask you this question, but please confirm the audio and video quality. We'll go ahead with our academic discussion as well. When you go buy a gadget, we ask for guarantee. I've seen several students saying like, we'll work this way, or even without saying that we'll work, they'll ask for guarantee like, uh, can we get success? Is it guaranteed? In fact, there are no guarantees. But as we discussed in one of the previous live sessions, through conscious effort, if we do or if we focus on the task at hand, and if you work consistently, and if we leave the rest of the things without overthinking or overindulging or without worrying about the results, then obviously rest will be taken care of. So it's a very simple thing, but often very difficult to understand or often misunderstood. But if you can get to the core of this entire thing, that is, just do what you have to do. That is, we need to do what we have to do, play our part, and rest will unwind itself. Yeah, so everything seems to be streaming fine. That's fantastic. So having a goal, understanding the situation, and the courage to act, decisive actions. The best example, as I said, I can give you is this 21-day challenge. To wake up early in the morning, to sleep early, to have little food, to have quality sleep, and to allot time towards essential activities for your own personal professional progress. We need courage to act without any doubt. So now let's move on to the academic part of the discussion. So where we'll have few images and a related discussion, right? I hope you guys are ready. And we'll also review some literature in the process. Simultaneously, you can make a note of various important points as well. So first of all, I want you to observe this illustration very carefully. This is lymphatic drainage of tongue. So you have images A on top, B on bottom, and then you have an inset image on right. So observe image A or illustration A. So it's a tongue, a lateral view. You can see various vessels starting from right side. You have apical vessels. So this is lymphatic drainage of tongue. Apical vessels, marginal vessels, basal vessels. And then in illustration B, you have these central vessels, all of them draining into various groups of lymph nodes. So often we have MCQs from these areas. In fact, we had one question regarding this drainage in one of the daily tests that's happening for regular batch now, anatomy. So you have jugulodigastric nodes, illustration B, you can see from top to bottom, jugulodigastric nodes, deep cervical nodes, jugulohumeroid nodes. Again, I'll get back to this illustration in detail. But before that, I want you to observe this illustration very keenly, right? So do observe, in the meantime, what is lymphatic drainage all about or lymphatic system all about? Often we have this confusion. Is it entirely different from our circulatory system, or is it a subset of circulatory system? So as per standard reference, lymphatic system, it's a subsystem or subset of circulatory system in vertebrate bodies that consists of complex network of vessels, tissues, as well as organs. This lymphatic system helps maintain fluid balance in body by collecting excessive fluid and particulate matter from tissues and depositing them back into the bloodstream. It also helps defend body against infection by supplying lymphocytes. Lymph, lymphocytes. So that's the gross overview of a lymphatic system. So this particular illustration is a lymphatic system of tongue where you have seen several vessels. I think I can point out with a mouse. So you have these apical vessels, as the name itself indicates, they drain the apical part of the tongue, right? And then we have these marginal vessels along the margins, basal vessels, posterior one third of tongue, and also we have these central vessels in a different view right? Anterior view, it's a cross-sectional view. Yeah, a longitudinal section, you can consider it as, right? So you have the central vessels. So just have this observation. Now we'll move on to the literature part. So first, apical vessels. So as I said, we'll have questions like this particular part of tongue uh, drains into, or the vessels from that particular part of tongue drain into which of the following group of lymph nodes, right? So apical vessels, as you can see, yeah, these are the apical vessels draining into submental nodes, and then some of them entering ultimately into jugulo-omohyoid node over here, right? Yeah, and also you can see some subset of drainage happening in submandibular nodes. So that's the illustration we have. Now let's review the theory part. So apical vessels, they drain the tip and inferior surface of tongue into submental lymph nodes after piercing mylohyoid muscles, right? So their efferents go to the submandibular nodes mainly. Some cross the hyoid bone to reach the jugulo-omohyoid nodes. So just keep this in mind. So the first point of entry would be submental nodes piercing through a mylohyoid muscles. Okay, so as you can see, apical vessels draining into submental nodes. As per the literature, most of them draining back into submandibular nodes ultimately, and some of them crossing hyoid to drain into jugulo-omohyoid node, lymph node. Okay, now this is the story of apical vessels. Now moving on to marginal vessels, again, as you can see, most of them draining into submandibular nodes. So these marginal vessels, as the name itself indicates, it drain the marginal portions of anterior two-thirds of the tongue unilaterally into submandibular lymph nodes because they are on margin. So right side will be on right lymph nodes, left side will be on left lymph nodes. So that's what they mean when when they use the term unilaterally. So marginal vessels, they drain the marginal portions of anterior two-thirds of tongue unilaterally into submandibular lymph nodes, as you can see here in this illustration, and then to lower deep cervical nodes, including jugulo-omohyoid. So you can just make a note of it, or you can simply focus on observing this illustration. You'll get all the information, all the required information, right? So this is the story of marginal vessels. Now moving on to basal vessels. So yeah, before basal vessels, let's look into central vessels, which is there in illustration B. So these central vessels drain the central portion of anterior two-thirds of tongue. So as you can see in the inset onto your right, so that's the central portion. And when they say central portion, they mean area within 0.5 inch on either side of midline. So 1 inch is approximately 2.5 centimeters. Within 0.5 inch, half of that. So they pass vertically downwards in the midline of tongue. Observe illustration B as we're going through this. So you can see they're passing through the midline, in the midline of tongue between the genioglossus muscles, and they drain bilaterally into deep cervical lymph nodes, right? So that's the story of central vessels draining into deep cervical lymph nodes ultimately. Now, moving on to basal vessels, the posterior aspect of tongue, they drain the root of tongue and posterior one-third of tongue bilaterally into upper deep cervical lymph nodes, including jugulodigastric, as you can see in this illustration. So basal vessels draining into jugulodigastric and also the upper deep cervical lymph nodes, right? So, if you observe, we have four groups of vessels: apical vessels, marginal vessels, basal vessels, central vessels, draining into different groups of lymph nodes. So ultimately, this lymphatic drainage is a way of clearing excess fluid or particulate matter into the circulatory system. So this lymphatic system, we find it everywhere throughout the body. So it's not just about drainage, it also has a significant role in providing lymphocytes, that is, infection control, isn't it? So lymphatic system can be considered as a subsystem or subset of a circulatory system. So in specific, coming to lymphatic drainage of tongue, So we have these four groups of vessels: apical, marginal, central, and basal. And we have seen various groups of lymph nodes into which these groups of vessels are draining. Right. So usually we have questions in terms of lymph nodes into which various groups of vessels are draining. I hope it's clear. And the simplest way, easiest way to remember all this theory is not to go through theory, but to observe the illustration simultaneously when you're going through theory. And next time, that is when you're doing this repetition or revision for the second time or third time, you just observe the illustration. It's a matter of less than 5 minutes, and you're going to get the entire picture of lymphatic drainage in mind, just like that. So that's the advantage we have with referring or studying through illustrations or images, right? That's what we have been trying to do. And most importantly, when you allot quality time, uh, early morning time, when you have highest concentration towards such activities, then it simplifies your job, and you'll start enjoying preparation, and most importantly, you'll have enhanced confidence. Okay, I hope this information is helpful. Let me know if you have any further queries or clarifications, or feel free to get back through mail. So yeah, right. So these are some of the things which I wanted to highlight in this particular video. And before I conclude, uh, remember it's day 5. Do not let any passivation to seep into your 21-day challenge. It could be obvious, but keep telling yourself, or keep asking yourself why you're doing this. You know, it's very simple. Ultimately, you're doing it for your own sake. You're doing it for your own progress. It can be personal or professional, but when you have, or when you incorporate these good habits, or habits which have the power to change your life, then I think you don't need any other reason to sustain these activities. So keep asking yourself why you're doing this, and I think that itself will eliminate all the passivation, if at all anything is seeping into the process of this 21-day challenge, right? So you can share your experiences regarding this 21-day challenge 5 a.m. club. You can get back through mail with feedback. And also, as I said, we'll incorporate more of these 21-day challenges in the coming days, coming weeks, and coming months, right? So again, before I conclude, it's all about working hard, working consistently, and most importantly, believing in yourself. So always keep these three things in mind. And when you're preparing, if you focus on the task at hand, as we've seen yesterday, mindfulness is very important. Simultaneously doing multiple things will create chaos and confusion. Rather, focus on the task at hand. You'll enjoy the process, and it will in itself sustain your preparation, right? And now, by now, it must be clear for you why most of the aspirants usually find it difficult to sustain preparation or to maintain consistency, because it's not that easy. You might work hard now, you might study for 10 hours today, but it's all about consistency. So, day 5, so it's all about consistency. Let's see how many of us will pull ourselves or push ourselves till the 21st day. In fact, 21-day challenge, 21st day is not the end of the challenge. In fact, it's a beginning of a new habit that's going to happen to you for the lifetime. So let's see. Anyways, have a fantastic day ahead. And if in case any one of you are missing any days in this 21-day challenge, don't feel discouraged. Continue joining us live at 5 a.m. club, and or you can get back through mail for any queries or further assistance. Have a fantastic day ahead. Love you all. And as I said, don't sleep now after this session. I'm not sure if you're sleeping now, since I can't see you. If it were a Zoom, I would have caught you. So don't sleep now, or don't sleep after concluding this session. Rather, involve yourself in some productive activity based on your passion, interest, or choice. And if you're really feeling drowsy, have a power nap, 20 or 30 minutes at 9:30 or 10 a.m., and then your entire day will be set. In fact, you would need a power nap if you haven't had a good sleep last night, or else if you had a fantastic sound sleep, then you'll be active throughout the day. Take care.